Meet Pete. Pete is 59 years old and spends much of his free time hiking and camping with his wife Gladys. Over the last few years, Pete has been having the urge to urinate more and more frequently, and has had trouble urinating as if there's something holding him back from being able to go. Pete also finds himself waking up multiple times a night to urinate, which can prove to be quite inconvenient. Pete isn't enjoying the great outdoors as much as he used to because of this constant discomfort. These symptoms could mean that Pete has an enlarged prostate. This is a condition called benign prostatic hyperplasia, or BPH. As men get older, it's very common for their prostates to enlarge. As it grows, it begins to put pressure on the urethra, preventing urine from flowing normally. This can lead to uncomfortable symptoms like those that Pete is experiencing. You're not alone if you're experiencing symptoms from BPH. BPH is a common condition affecting 50% of men over the age of 60, and 80% of men will develop BPH in their lifetime. As the prostate continues to get bigger, uncomfortable symptoms can begin to occur. Additional symptoms can include a sudden, frequent need to urinate without emptying the bladder completely, painful urination or difficulty urinating, and a poor stream during urination. You might be thinking, well, what are the options for treatment, and how do you and your doctor decide which is the best option for you? Pete decided to meet with his doctor to learn more about his treatment options. Pete's doctor explains to him that he's not yet ready for surgery and should consider the new iTind prostate reshaping procedure. Prostate reshaping is a simple, in-office procedure that will help him quickly return to his normal routine without the need for continued BPH medications, permanent implants, or painful treatments. This iTind procedure is an effective treatment with rapid symptom relief and will preserve Pete's sexual function. iTind is a temporary implant that's inserted by your doctor in a straightforward in-office procedure using a small camera called a cystoscope. You'll be able to go home within a few hours of the procedure. After you go home, this is when the iTind really does the work, reshaping your prostate. This temporary implant will stay inserted for just a week, allowing you to relax at home and catch up on your favorite TV shows. After a week, you'll return to the office so your doctor can remove the iTind device. You'll be able to go home feeling immediate relief without the need for an uncomfortable catheter. In studies using the iTind device, patients saw a reduction in urinary symptoms and improvement in quality of life of up to 60% and up to 60% improvements in urination flow. Pete is thrilled to have discovered an effective treatment for his BPH symptoms that eliminates the need for medication or painful procedures. Pete can finally be in control and get back to doing what he loves most. Ask your doctor if iTind is the right treatment for you.
Implantation of the iTind system may cause urinary urgency, pelvic discomfort, dysuria, and hematuria. In rare cases, iTind may cause urinary tract infection and acute urinary retention.